So the only answer which we can give actually for this unfortunate story is that there is callousness all across. There is a sheer neglect of healthcare right from the primary level sources. If you look at the diseases or the illnesses which have been documented, it shows extremely poor antenatal care. Antenatal ultrasounds perhaps were not of good quality. Congenital hearts can be diagnosed from 14 weeks of gestation age going onwards. Why were they not picked up? What was the diagnosis at the time of birth? What was the screening done, newborn screening done? And of course, the other facilities which require ventilatory care, oxygen supply, sterile beds for kids who are in respiratory distress, checking for jaundice at an early age so that we don't let that go out of hand because that damages the child's brain permanently. Now, these children, if they are referred to any referral center or a government hospital at late stages, the death rate is almost 100%. It's virtually impossible for anyone to gain control on the mortality once a newborn goes out of control. The big bad H's in newborn is hypothermia, that means low temperature. Hyponatremia means low sodium. And more importantly is hypoglycemia, that means low sugar. And all these three are a corollary, a direct fallout of infection, which you call as sepsis, delayed respiratory care, which is because of the respiratory or lung condition, or indeed prematurity. We need not an audit now. We need an audit of the last 10 years. I'm not belonging to any political party, but the previous government has been there for the last 10 years or 12 years or 15 years. Why are the government officials and the people who were holding posts at that time, why are they not being held responsible? The healthcare facilities cannot come up overnight. What was done for newborn care? We still are having a very high under 5 mortality, which is 27 per 1,000 live births. We are having a neonatal mortality of 17 per 1,000 live births. We are having an infant mortality rate of 28 per 1,000 live births. We have very low newborn care facilities all over the rural India, especially in places like West Bengal. We have 66% incidence of anemia in small children. Someone needs to give an answer. There's a very old and famous saying, I am today what I was yesterday. I will be tomorrow what I am today. If we don't look after newborn care now, we will have a sicker, smaller child population, sicker adolescent population, and a much weaker adulthood, and which will be ridden with diseases and illnesses which are largely preventable.
Doctor, 44 of the 60 babies had been born elsewhere. That's what the Malda hospital is continuously saying. That's what the medical superintendent is continuously saying. They were referred to Malda after their conditions deteriorated. What does that tell us about the quality, the timing of the neonatal care before these referrals actually happened? You spoke about callousness, but help us put these numbers also into perspective. 44 of 60 babies born elsewhere, referred to Malda after their condition deteriorated. For a critically ill newborn, how crucial are the first few hours? Let's paint that picture for the public as well.
Yeah, so the main focus is now, if a child is really critically unwell, even 15 to 20 minutes of lack of oxygen or lack of ventilatory support is goodbye for the newborn. Within an hour or two with low sugars or low sodium or low calcium is goodbye to the baby. When you're looking at without adequate cover of broad spectrum antibiotics in case there is neonatal sepsis, more than few hours, it spells danger. The real issue is, where is the ambulatory support as far as transportation of these newborns is concerned? Do we have a worthwhile ambulance in West Bengal? Do we have a worthwhile transport facility at all, even in Calcutta? These answers have to be given for the sequential governments for the last 2 decades. How is a critical newborn going to be shifted? Most of the time you see these horror stories in which really anxious parents are carrying a very sick, gasping, literally dying newborn in their arms. Is that the way to treat a child? Is that the cost of a human life in India? Is that what we want in newborn care? The answer is no. We need an audit. The audit must be made public. Hold the people who've been responsible, name them, shame them. Unless until you don't put punitive damages on every government servant in West Bengal who has literally let the country and humanity down. We've seen fires in newborn units. We have seen a gang rape of a resident doctor in Calcutta earlier. Now we are seeing these kind of stories which are largely preventable. It's just sorrowful to hear this, that no one actually cares in West Bengal.